Welcome back. It's Dr. Jennifer Bunny, Doctor of Physical Therapy, better known as Doc Jen Fit, owner and founder of Gen Health, your one-stop shop for all aches and pains, or just needing to follow something so that you feel better within your body. Now, I want to tell you, I had the worst round ligament pain this pregnancy in second trimester. Like, I wanted to shuffle my feet to the side to get around rather than actually picking up my feet. Have you experienced this? Let me know in the comments if you also experience round ligament pain and like that shooting pain kind of in the front, or that searing pain when you're trying to like walk or be functional. It was kind of crazy because I never experienced it in my first pregnancy. So it's been a wild journey, but I'm going to also tell you about the plan that's helped to keep it away after I show you some of the exercises that really helped so that I got rid of the pain right away. Now, all you're going to need is a little therapy ball. I prefer the therapy ball from Tune Up Fitness because it has a little bit more give and grip that's better suited for the body rather than a lacrosse ball, which is just so tense and tight. And especially in the pelvic floor region, we want something that has a tiny bit more give so that it helps really relax the pelvic floor. We're not trying to dig into anything. We're trying to relax. Okay. So that's going to be the first thing that I go to. Now I'm going to have this linked up. So you can find the therapy ball yourself, all of their balls. I highly recommend. It's the tools that I have been using for years myself and I use with my clients. But what we're going to do with this is we're going to take that therapy ball and we're going to take it right on the inside of the sit bones. So you can find your sit bones by kind of rocking forward and back. And those nubby things that you feel, you can even use your hand. You can kind of find it. So those nubs right into the booty, those are your sit bones. And it's going to go, if you wrap your fingers on the sit bone, it's going to go right on the inside of that sit bone. So it's not going up any holes, I will say. Okay. And what we're going to do here is just find areas that like feel like, whoa, that's a little tense. Maybe I can't even relax my body into it. And I'm just going to try to breathe. You can use your hands for support if you need to, but you're going to try to be on a harder surface too. So you don't want to be on like a squishy couch because then the ball is just going to melt into that couch or the chair. Try to be on a harder surface. That's why I like to do it on the ground. And you're just going to take slow, deep breaths. My goal here is at least a minute on each side. Or you can count to like 10 really slow breaths. That's like a really good way of gauging it. And you can also like move in different positions. So find different areas of tension. You can move the body if that helps you to relax, close your eyes, hum, like whatever helps to kind of get you into that relaxation. Once you take it out, you're going to be like, whoa, doesn't feel tense or tight there at all. And then try the other side. And again, right inside that sit bone, and then you sit onto it. Okay. And you can go forward, you can go back, you can find those different areas of tension, and then you use your breath to really relax that tension. So the goal isn't to fight into it or grimace or anything. So if it's too much, use your hands right now and support your body and kind of jiggle out your body, trying to relax, breathe, hum, all those different things that help to relax the nervous system. That's going to help to relax that pelvic floor. So we can be building up tension into that pelvis unknowingly, which can refer some pain or tension up into that round ligament. Okay. So then I love hip 90-90 because this is going to help to relax tension around the pelvis. So if you know that you are super tight in your hips, I want you to elevate the surface by sitting on a stack of pillows, a stack of blankets, a stack of towels, something to kind of elevate your hips. But what you're looking for is 90 degrees in that front leg, 90 degrees between your legs, 90 degrees in that back leg. When I'm stretching to the front, I want to think of my belly button lifting and my back staying straight as I lean over this leg. Now you're thinking of this knee kind of pushing back into your hip, and you should feel a stretch into that glute. We don't want to round the back and lean forward because then we lose that like deep hip stretch. We really want it to be a hip stretch, not a low back stretch. So you take some breaths here. I recommend at least 5 to 10 breaths, especially depending on how tight you feel. Do some really big relaxation. Again, how can you get that body to relax a bit more? Then as you come back, rotate toward this hip, almost like you're thinking of wrapping that hip down and around and you're sitting on the bottom. You're going to feel a little bit of tension here. You can use your hand, massage into that hip, close your eyes, relax, try to breathe 5 to 10 breaths. Then you're going to try it on the other side. So I'm not going to do the full thing with you because it depends. Maybe you don't need this one as much. Maybe you're already super open, right? Maybe when you find that 90-90, you lean over, you don't feel that much of a glute stretch. That might mean you don't need that front, but maybe when you go to the back, you're like, whoa, that leg is tensing up on me. You need to spend a little bit more time here. Okay. So there's always differences within our body based on what we need individually. So that's where you're going to start to explore and find what you need to. Now, hip flexor stretch is always key and crucial here, especially with round ligament pain. So what you're going to do, set your leg up. You can have a pillow or more cushion under your knee as needed. And you're going to tuck that tailbone under. So we're already starting in a tucked position so that pelvis isn't forward. So tuck that tailbone under, give a little glute squeeze in the back. This front hand, I like to slide in front so that you get a little bit more support and stability. So kind of push it into that leg. Reach that top hand up. Now, as I'm going to reach up with that top hand and lean over and turn slightly. You should already feel a lot of stretch here. If you need a little bit more, that's where you can tilt forward just a tiny bit. Keep that bottom tucked under and squeezed. And you're going to take 5 slow breaths here. Okay. That's how we really maximize getting into that hip flexor stretch. Try the other side as well. So again, you tuck that tailbone under, squeeze that booty, slide that hand in so it's supported. Reach that top arm. I'm going to reach up and over my leg, slight rotation. And if I need to, I'm going to come forward just a tiny bit. It's not a huge lunge, especially when you set everything up in really good positioning with that bottom tucked under. And then you do 5 breaths there. You're going to see how that's going to start to open up that hip flexor stretch. And this might be one that you come back to like all the time, day by day. Now that was all great for relaxing around the pelvis, but one area I see that people tend to neglect is relaxation around the upper back and rib cage. So that's what we're going to do next. So you're going to lay on your back, and this is great to do either when you're in bed, before you get out of bed, or before you go to sleep, or just in the middle of the day. So you're going to relax your pelvis and legs as much as possible. And you were going to do a little rib cage dig here. So you're going to try to find in your rib cage and just do a little bit of a dig. Breathing in to those fingers and breathing out. Our diaphragm already gets so flattened during pregnancy, so it makes it really hard to feel like you can take a deep breath. So really starting to find that mobilization, release tension and pressure is really key. If it's really uncomfortable for you to be on your back, you can always elevate onto like a 45-degree angle, or you can even do it laying on one side, relaxing the body, and then switch and flip to the other side. I usually like to say about 5 to 10 breaths on each side, kind of digging in where you feel a little bit of tension. Take a breath in. Take a breath out. Okay. Or you can even convince your partner that this is necessary and you relax and they do it for you. Okay. But just getting right underneath that rib cage, you can do this all the way up until birth. And it really helps to relax that tension. Then immediately kind of following that, I like to open up the upper back. So that's where I do something like an open book. Whoops, I kicked my ball out of the way. So you can have, I love having a pillow here for support on that leg. I forgot to grab one for this video, but you're going to have a pillow to kind of support this leg so that the hip doesn't drop too much and you don't get too much tension around that belly. Breathe in as I reach, breathe out as I open. Now, I have a couch. It's kind of blocking me. You can open up your arm all the way. You can let it relax. You can come into that football post position if that feels better. But you take a breath in from that back of the rib cage as you reach forward. Breathe out and open up that chest and that rib cage area. Okay, so this is really going to help to relax that tension along that upper back. One of my favorites to do first thing in the morning. You do a little ribcage release. You do a little open book before you get out of bed, and you're going to help to relax that tension. Do this every day. I'm telling you, it's going to be a game changer. After open book, that's where any kind of cat-cow variation is really great. So if I'm on all fours, I'm going to open out and round. Maybe I go in a circle. So again, focusing on that upper back, that breath. Maybe I'm going to go side to side. So how can I get that rib cage and upper back open a bit more? And then ending with a little bit more active rotation. So open book is a little bit more passive. So to make it more active, you can be on all fours and then push through that bottom hand. Breathe in as you rotate. Breathe out as you come back. Breathe in, make it active and rotate around that rib cage. And this might, again, take a lot of practice to kind of feel into. So feel both sides. Coming down and rotating, coming down and rotating. But finding that active mobility is so crucial so that we maintain that mobility around that rib cage. And it's going to help. Hopefully you'll notice when you're walking, you're starting to feel a little bit of relief around your low back. You're starting to feel a little less pressure along that belly and hopefully a little bit less grabbing along that low round ligament area. Now, I also want to say the one plan that really helped to make sure it didn't come back, because I only had this for a few days, really, which was excruciating in the time that I had it. But what helped it to not come back after doing all this mobility was following a mobility plan so that I didn't have to think. I didn't always have to do. I just had something to be able to follow easily. Now we have a full body mobility plan that has multiple phases on Gen Health, and you can get started with it for just $20 if you use code OPTIMAL at checkout. So I'm going to leave that linked up. You can completely explore it for a week free, but you can also get a full 30 days for just $20 to get started. And then after that, it is $25 and you can cancel at any time. We have so many plans on the platform as well beyond just full body mobility, but this is a great one that I continued to come back to. And of course, if you have other requests, please drop it in the comments below. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.